Can anyone answer what is holistic concept or holistic nutrition? Hello?
Complete nutrition, ma'am.
Yes, ma. Who is this?
I'm Sukangshni, currently pursuing final year of graduation
Hello?
from applied nutrition, ma'am.
Okay, very good. Yes. Tell me, what do you understand when you hear this word holistic?
Complete nutrition, ma'am, I guess.
Okay. Okay. And in relation to diabetes, how do you think it is related to diabetes? Okay. So good that you gave this answer. Very good that you came up. It is yes. What you said is like complete care or complete nutrition is good. So now my next question is, how many of you think, no, actually the cause of diabetes, is known to us? Or let me ask you, what is the cause of diabetes? Yeah, you can unmute and answer, guys. What is the cause of diabetes? Hello? Hello?
Obesity and inactive lifestyle in our
Very
daily
good.
life.
And
Hereditary.
okay. And
The incapability of digesting food. I mean, sugar, converting it into sugar and using it.
okay. And so, okay. These are all good. Now tell me, what are the risk factors for diabetes? Hello? Yes, all those who are answered, all of you are correct, ma. All those, are some of the risk factors, some of the causes. But what are the risk factors of diabetes? Why a person is getting into the risk of diabetes? And people who are there in the YouTube, you may please put your comments in the comment section or put your answers there in the comment section as well. And I think the number is going on increasing. Thank you so much for all the new joinees for taking out time on this busy day also. It's weekend, we understand. But thank you so much for joining. Yes.
Yeah, Sandhya, it is 11:10. I think it's time we start. Shall we?
Yes, sir. Perfectly, sir. We will start, sir.
Thank you. So is my screen visible to everyone?
Yes, sir.
Yes.
My voice okay? Are you able to hear me?
So little low, sir, can be increased.
Okay. Is it clear now?
Yes, sir.
First of all,
Now it is
very happy good morning, everyone. And first of all, at the outset, I would like to thank Varalakshmi ma'am, Dr. Varalakshmi ma'am, for giving us this opportunity to interact with your students. And also thanks to Prasanna for giving us the opportunity to talk to your students. And she's an alumni of SDM SMK. So, so today's topic is access to diabetes care, the holistic way. Access to diabetes care is the theme for World Diabetes Day from 2021 to 23. So the next 3 years will be, the theme is going to be access to diabetes care. Okay, so my name is Dr. Suresh, and I am the founder and chief coach at Holistic Nutrition Training Program. And you don't have to waste much time. I mean, I don't want to waste much time of yours by telling about myself. So as you can see, I'm an MBBS doctor, but I'd be happy if you call me a dietitian, because I would feel more happy if people call me a dietitian than a doctor. So having said that, the first question is, when do we go to a doctor and why? Simple question. When do we go to a doctor and why? The answer is as simple as that. We go to a doctor when we feel sick, when we have illness. And why we go to a doctor? To get a complete cure, isn't it? But excuse me. But do we have complete cure for any kind of illnesses that we are seeing nowadays? Do we have a complete cure for diabetes?
No, sir.
Allopathy? No. And for hypertension, heart disease, arthritis, rheumatoid arthritis, cancers, hypothyroidism, do we have a complete cure? No, right? Are you with me?
Yes,
So
sir.
what
Yes,
the doctors
sir.
are doing then? What doctors are doing then? So diabetes is only being managed till now. There is no complete cure. That means all the doctors, whatever they are trying to do, they are managing the disease. We call this as disease management. And someone who manages disease are called disease managers. But I don't want to be a disease manager. I want to be a health manager. Okay. So who is a health manager? We'll come to that. So before that, let me ask you, let me give you a simple example. Here is a woman. There is a problem with her plumbing pipes in her kitchen. And she called for a plumber. And he came and he fixed the pipes. And she's happy and get on with her work. But the next day, the problems resurfaced. And she called up the plumber again. And he fixed it, he went off. And by the evening, again the problem resurfaced. And again the plumber has to come and fix it. That's okay if it is only for a couple of days, but the problem persisted for the next day, morning and evening, and the next week, and every day throughout the week, throughout the month, and throughout the years. Okay. Here, how many of you are comfortable calling an electrician or a plumber or a mason or someone who comes every day, 3 times in a day, to come to your home and fix it? How many of you are comfortable with this condition? Nobody, right? But this is exactly what the diabetic patients and other chronic lifestyle disease patients are going through. Okay, here the plumber is our medicine, and the house means our body. The lady is us, or the diabetic patients. Okay, this is exactly what we are doing. If there is diabetes, people are sentenced for a lifelong medicine. There is no cure if you choose to have allopathy, exclusively allopathy, right? I'm not finding fault with allopathy, but if you choose to manage your disease, you have to take medication, because we are not going to understand what diabetes actually is. So if this is the current model of diabetes management, this is not the correct thing. You are just managing, you are not curing. So what is the point of going to a doctor then? So before we ask this question, we come to this conclusion, we need to understand what is the cause of diabetes, right? If you ask a doctor, and just now Sandhya ma'am asked all of you, what is the cause of diabetes, right? Can anyone tell? Somebody said hereditary, and somebody said not able to process the food properly, and someone said what is this, lack of insulin, right? So the cause of diabetes, if you ask an MBBS doctor or an MD or a super specialist like an endocrinologist, they have only one answer. That is, we don't know. We call this as idiopathic. I'm talking about type 2. Okay, nobody knows what is the cause of diabetes. All we know is like the sugar levels are high, there is hyperglycemia. That means blood sugar is more than what is supposed to be, called as normal. And we use medication to bring the sugar level down. We are not looking into the cause, what made the body to hold on to more sugar. We don't know, right? Whatever you said, they are called risk factors. They are not cause. Say, for example, if you take 100 patients of malaria, you can extract or you can find plasmodium. Sorry, Plasmodium in all those patients, in all those 100 patients, because Plasmodium causes malaria. You do a smear test and you'll identify this pathogen. Okay. Now, if you see 100 diabetes patients, do you think that all of them, they have hereditary causes? No, they are called risk factors. Lack of exercise, unhealthy eating habits, and stress, hereditary, all these things, they are called risk factors. They are not the cause. Okay. Now, we don't know what is the cause of diabetes, and we don't know why it has come into our life, and we are just managing it with medication. So I never felt that comfortable with this formula, because when you look at human body, this is the egg, female egg, and this is the spermatozoa. So human life, every one of us, our life started like this, with a single cell in mother's womb, isn't it? And this single cell divided it into two, and the two become 4, 8, 16, and finally within 9 months, this single cell becomes a full-fledged human life, a baby, fully functioning baby. Now my question is very simple. Where is this knowledge of creating an extraordinary organ like eye, for example, with rods, cones, retina, cornea, sclera, and all these things, right? Where is this knowledge hiding to create an organ like an eye, or a kidney, or a liver, or to create those hormones, or enzymes, or proteins? Where is this knowledge? It is there in this single cell. It is there in all trillions of cells that a human body is capable of. My simple question, if the body knows how to make itself into a full-fledged functioning system, so I don't want to call human body as a machine. They say that heart is a pump. So that is like the most disrespectful thing that one can say about body. Body is not a machine. Body is not just a machine. It is an intelligent system. Imagine the DNA that is there in the cell is capable of creating these trillions of cells, and it knows how to create a body. Don't you think that if there is a damage or an injury to some body part, don't you think the body has the capacity to repair on its own? Yes or no?
Yes, sir.
It does. It does have the capacity to repair on its own. But why it is unable to repair? Let me give you a simple example. Say, I mean, your college building, you are the architect. You constructed the whole building. Okay, all the buildings in your campus. You are the architect. You know the foundations, you know the rooms, you know the material that has gone into constructing that building. Now, because of an accident or something, one particular part of one building is got damaged. Now, they call you because you are the architect and they gave you all the money to repair it. Now, the question is, do you have the capacity to repair that building? Yes, you do have that, because you are the architect. You designed it in the first place. You know how to repair it. You know what kind of material is required, and you have all the money. But when you go to market to get masons or material like sand, bricks, or steel, or iron, whatever it is, with all your money, you are unable to buy anything. Nothing is available. Now, can you repair that? You can't. Similarly, if there is some imbalance in our body, the body knows how to repair, but to repair itself, it needs right kind of raw material. Don't you think so? And where is this raw material coming from? It is coming from the food we eat. Got it? The food we eat, because we are not giving right kind of raw material for the body to repair. Simple thing. If this is a finger and there is a small scratch, I mean, small cut on your finger. So what are the three things that you will do? Take a TT shot, take an antibiotic, and a painkiller. So TT shot, antibiotic, and painkiller. My question is, out of these three, which one is actually helping you repair your wound? TT, antibiotic, or painkiller? Which one? Answer is D, none of the above. TT and antibiotic, they prevent infections, and painkiller is reducing pain. But who is repairing? The body knows how to repair on its own. Don't you think so? So this thing to repair, body needs right kind of raw material. Where is it coming from? So the body is the actual healer. Where is it coming from? Just look at type 1 diabetes. Type 1 diabetes, there is a defective gene because of which the pancreas islet cells of Langerhans unable to produce enough insulin. We call this as type 1. But the real problem, more than 95% of the people suffering with in the world are with type 2 diabetes. And this is a programmed gene, a programmed condition. I don't call diabetes as a disease. It is a simple hormonal imbalance. Okay, it is just a disorder. There is no order. The order has got lost. Okay, so if the gene is being programmed, who is the programmer then? And what kind of instructions the programmer is giving to these genes? So let me ask you, I mean, most of your postgraduates and graduate students, you might have covered your protein metabolism by now. What is the function of a gene? The function of a gene is protein synthesis. That is how our body is made. Every day, genes in our chromosomes, they need some signals. They need some signals from the environment. There are two types of environment. One is external environment and another one is internal environment. Are you able to see me?
Yes, sir.
Okay. So what is external environment and what is internal environment? Internal environment is, see, each and every cell is supplied by a capillary. So capillary carries blood, and blood contains blood constituents. So you have all the nutrients or metabolic waste and hormones, enzymes, and everything is traveling in the blood. And the kind of nutrients our blood contains at any point of the time depends upon the kind of food we consume. If I am consuming food that is rich in carbohydrate, my blood sugar level will go up, isn't it? So I am changing my internal environment. That means my blood biochemistry. So that is a signal to the genes, and genes accordingly will make more protein. Protein, insulin, isn't it a protein? It's a hormone, right? It's an amino acid. So it produces more insulin. As simple as that. So that this sugar level comes down. Similarly, if there is more protein and the external environment, whatever we do, if we do regular physical activity, what happens? So the body, there is a demand for making more muscle. So all the protein is converted into muscle. If there is more fat or lipids in the blood, it is stored in adipose tissue. Again, more production of insulin. So the purpose or the function of gene is to make protein. So that means what? Genes are not just a software, but who is using that software? Say, for example, my system, my computer, I'm sitting before my system. If I type, "You are a good boy, Dr. Suresh," what I'll see on my screen? You are a good boy. That's it. If I say, "You are a very bad person," will my computer say that, okay, don't feel bad about yourself, you're a good person? Will it say like that? No. Genes as such, they don't take any decisions. They listen to the signals, environmental signals. What kind of food we are eating, what kind of exercise that we are doing, how much stress we are prone to, all these things, the external environment changes our internal environment. That is our blood biochemistry. So when that is changed, accordingly, the genes are programmed. Is this clear? Or am I confusing you? Clear till now? Please raise your hand, say something. Yeah, thank you. Sukhankshini, thank you. Yeah. Okay. Right. Monica, thank you. Okay. So what is happening here is we are programming our genes, and finally we are ending up with the type 2 diabetes. So here, if type 2 diabetes someone is suffering, it is because people are not paying attention to what they are eating. So why they are not paying attention? Because they don't know what food can do and what human body is capable of. Okay. Now, if you look into human body, what happens is there are three things that are happening on a continuous basis. One is creation, second is maintenance, and third one is annihilation. What is creation? What is creation? So human body is always in dynamic equilibrium. What is dynamic equilibrium? So we all know that red blood cells, they live for 100 days. Yes. That means what? They do have what is known as an expiry date. Yes, they do have an expiry date. That means every 100 days we'll get a new set of RBC. Is it so? No, it is not. So every day 1/100 of RBC in our body, they get recycled. Okay. So there are like close to 25 trillion. Trillion means 1 lakh crore. 25 lakh crores of RBC are there right now in our body. In that, every day 25,000 crore RBC are being produced. Every day, right now, I mean, since we started for last 20 minutes, hundreds and thousands of crores of RBC are being formed in our body. And they are getting recycled. Similarly, there is an expiry date for each and every cell in our body. RBC, not only RBC, the skin cells, the muscle cells, the bone cells, everything get recycled. Okay. So in a year, the whole human body gets replaced. Okay. So that is a continuous creative process. So there is continuous process of regeneration and continuous process of degeneration. So body is always in dynamic equilibrium. It is not static. Okay. That means we are growing every day. We are being rebuilt each and every day. Similarly, there is maintenance. Body knows how to balance pH, how to balance pressure, how to balance temperature. There are so many things that the body balances, right? It balances acid production and it balances urine production and everything. So, and similarly, there is annihilation that is happening, that is destruction. So if billions and billions of cells are being formed, so some of the cells, they can be defective. There are cancer cells that are there being formed in each and every one of us, every day, every minute, every second of our life. But we have natural killer cells which are capable of killing those cells immediately. Got it? Immediately. So that means all these things are happening only with the help of the food we eat. And when all these things are in perfect synchronicity, in sync, and we eat right kind of food, when we eat right kind of food, what happens is we remain healthy. And who is supposed to teach the people how to eat? It is the dietitian. If someone is not healthy, that means what? A dietitian is not doing her job well. Okay. So, and this also is an opportunity. Why this is an opportunity? How many of you think that this is an opportunity? That means people, they don't know what kind of food to eat. Yes. And we have an opportunity to teach them. That exactly is the job of a dietitian. Now you got it? And when we do this, what happens? We are creating health for an individual. Yes. And they say health is wealth. And when you are creating health, what you are creating indirectly, you are creating wealth for an individual. So this is all about being a dietitian. That is the reason why I prefer to be called as a dietitian rather than a doctor. As I said earlier, I don't want to be a disease manager. I want to be a health manager. And health and everything that is happening in the body and everything that the body is made up of depends upon the food. If I know the correct information, if I have correct knowledge about the diet, okay, then I can make people healthy and I can make people wealthy as well. Got it? So what is the current scope of a dietitian then? So now we know what a dietitian is capable of. A dietitian is capable of making people healthy. Yes? Yes or no? Hello?
Yes, sir.
I mean, why so weak, sir?
Sir, your video is stuck, so can you please?
Yeah, I know. I'm trying to fix that simultaneously. Okay, I'll come to that. Right? So, don't you think that a dietitian is capable of doing that? Yes?
He or she is capable, sir.
He or she, yeah. So, what is the scope for a dietitian now in the current system? Either you can work in a hospital or start your own clinic, or you can start working in a food industry or hospitality industry, or you can, if you're interested in teaching, you can go into academics, or if you're interested in research, this is it. But what about the compensation part? How much dietitians are getting paid for all the hard work they do? Okay, let me ask you this question directly. Once you complete your, what do you say, internship, after completing your post graduation, say for example, not graduation, you completed your post graduation, you completed your internship. Okay, so you go to any of this field. What is the starting salary for a dietitian? Anyone?
15 to 20K.
Oh, people are paying 20 also for a dietitian. Seriously? Huh?
13,000, 13 to 15K.
13 to 15K, good. That is more reasonable. And are you happy after completing your 10th standard, 2 years in sciences, and then 3 years of graduation and 2 years of post-graduation and 6 months of internship? Are you happy getting 13 to 15,000 after that?
No, sir.
Okay. See, just now I told you the power of nutrition. What a dietitian can do if she puts her heart into the work. Okay, that is the power, and that is the reason why I choose to be a dietitian, not a doctor, because a dietitian is much more powerful than a doctor. That's what my belief system is. So if a security guard is making 20,000 a month in the hospital, and the same hospital, a dietitian who is a postgraduate is getting only 13 to 15,000, how fair it is? It is not, right? Let me tell you what you can do now. How about becoming a holistic nutrition coach? This is how a dietitian, a holistic nutrition coach, can be compensated. Okay. So if you see 4 patients in a month, just 4 patients, that's it. And if a patient pays 12,000 to you, straight away you are getting 50,000, isn't it? And what if you see 8 patients who are paying you 12,000 per head, you are making 1 lakh. What if the patient pays 20,000 once you get enough experience and you become senior? Where is 13,000? Where is 1,60,000? Yeah. But the question is, will the clients pay that much? Will the clients pay that much? So I'm going to give you an example here. Okay. So this is a client, Mr. Jagdish, and he paid one of the coaches 15,000. And this is the screenshot that our coach has sent me. And that coach is none other than Sandhya, who organized this session. She sent me this a couple of days back. Okay. People are willing to pay you that premium only when you do your job as a dietitian. So how many of you are willing to or will be happy to earn while you learn? I'm sorry. Yeah. While you are learning, how many of you wanted to actually do this? How many of you want to be a holistic nutrition coach? It is possible. While you are still doing your graduation or post-graduation, it is still possible to make money by doing what you are studying. How many of you are interested in this, learning about holistic nutrition? Any raise of hands? Only 2 people, only 5 people out of 59. The rest of the people are not interested. Okay, good. 9 people are interested out of 59. Only 8. Okay, good. Yeah, 10. So what is this holistic nutrition, and is it something new or is it totally different? Okay, no, it is not. There is a difference between clinical nutrition and holistic nutrition. So this is a statement by Hippocrates, almost like 2000 years ago. What he says is, I would rather see what kind of a person has a disease than what kind of a disease a person has. Okay, what does it mean? So diabetes is same for each and every person. Okay, but the person having diabetes is different. So there is nothing in clinical nutrition. What we see is we plan a diabetic diet. In holistic practice, what we plan is we plan a diet for the person. Because if there are 750 crore people on this planet right now, do you have another copy of you in this entire population? Right? So we have, I could see Renuka Devi here and Prasanna and a few more people. Okay. My question is, do you have, yeah, we have Dharani, Sukankshi, Uma Maheshwari. Yeah, my question is simple. Is there any other replica of you in the entire world? No, right? That means what? Every person is unique. Similarly, every patient is unique. If there is a diabetes for that particular person, we need to know, of course, about diabetes and the diet principle for diabetes, but at the same time, we need to study the person. The person is more important than the disease. This is propounded, this is given by Hippocrates almost like 2000 years ago. But what we are doing is we are trying to treat the disease, but not the person. Holistic is all about treating the person. Okay. So I'm going to give you a simple example why people will pay and what is treating a person. This 52-year-old lady, okay, from Rohtak with 13 HbA1c, okay, and it has come down to 6.5. She has been suffering with diabetes for so many years, and she is unable to get up from the bed, unable to eat the food. She feels very weak. Okay, but just in 3 months, it has come from 13 to 6.5. Do you know who did that? A student from your college, right? Prasanna is an alumni of Siddhartha Mahila Kalashala, and she is the proud alumni of your college. She did that. She now stays in Gurgaon in New Delhi. Okay, and she didn't even see the patient, just over phone within 3 months. Just within 3 months, she is able to achieve this feat. And don't you think that a patient who is bedridden and got treated, and now she is able to walk, she is able to eat, and she is able to take care of herself? Don't you think that people will be happy in paying 15,000 for that? Yes or no?
Yes, sir.
Okay, this is what treating the person is different. This is what treating person is, and how treating a person is different from treating the disease. So yes, she did go to an endocrinologist or a, general medicine. She is taking medication. She went to a dietitian and they gave a diet plan, and don't eat this, eat this, and all these things have happened. But nobody treated the person. They treated only the disease. What is diabetes? Avoid carbs, avoid refined carbohydrates, don't eat banana. And these are like principles. They are not the treatment. Okay, once you understand the reason for the diabetes in that particular person, then you can start treating them from the roots. So it all depends upon reading the person. It depends mainly on the art of history taking. And again, Sir William Osler, he is a Canadian physician. What he said is, what is happening in patient's mind is more important than what a microbe does in his lungs. He is talking about a tuberculosis patient. We all know tuberculosis is because of tubercle bacilli. And if you give right kind of antibiotic, the bacteria will die and the patient will become healthy. But it is not that simple. If the patient thinks that, okay, I am affected with tuberculosis and I am going to die, if he is negative about his disease in his mind, whatever antibiotics, whatever the treatment that the doctor is giving, it is not going to help. But if the same person is positive about taking medication, believes in the doctor, right? Whatever is happening in his mind is more important. That's what he said. And that's why he is called the father of modern medicine. And that's what all the holistic coaches, they do. And here is another woman who is like very well educated. She worked as a principal, retired as a principal. Okay. And she has been practicing meditation for so many years, but still suffering with hypertension for almost like 17 years, and taking medication for diabetes and hypertension just within 42 days. And she is none other than the very person who organized this session, Sandhya. Okay. Within 42 days, her pressures, blood pressures have become normal. How did this happen? Because they know how to treat the person. They learn how to treat the person in a holistic way. Okay. So how do you take as a dietitian your history? You go through demography, anthropometry, BCA, 24-hour recall, and food behavior. But do you know what holistic coaches do? They go into each and every aspect of the patient's life. They spend hours together with the patient in understanding what they are, their personal history, their education, their professional history, family medical history, their religious beliefs, hobbies, interests, best moments in life, worst moments, okay, love-hate relationships, and all these things, they do matter. Because whatever we think, that get manifested in our body. When you are angry, it gets reflected in our body. When we are happy, it gets reflected in our body, in our metabolism. When you are happy, your body feels lighter because happy hormones are released. Okay. And each and every moment, our metabolism changes according to our thoughts and emotions. And we are living in a world, and it is our belief system and thoughts that changes our physiology and leads to pathophysiology like hypothyroidism or PCOS or diabetes. If we know how to study this, how to read this, okay, then that is how you become a holistic coach. So for this, we have a 1-year program where you will be given all the video lessons, right? There are 26 video lessons and 26 live discussions on those lessons, and more than 50 bonus lectures to support that, and weekly live sessions on the program. And doing this, you can become a holistic coach. Okay. See, a diet plan can be given, and you can get diet plans for free from internet these days. And there are enough softwares that can plan a better diet plan than a dietitian. But no machine, no software can be better than a person talking to another person. That's what holistic coaching is all about. That's what these coaches, they do. Okay, if some of you can watch Danya over there, Danya is one of the coaches. She is from Bangalore, and she made a 50-year-old man suffering with diabetes jump like a kid. Okay, you can go through our YouTube channel, and he clearly mentioned it. I am jumping like a kid these days after talking to Danya. This is what holistic coaching is all about, right? So how many of you are interested in learning this holistic nutrition, these principles? Two people, four people. Okay, six people. Right, 10 people. So before I tell you about the program, and I mean, you have the website over here, hntp.online, where you will get all the details about the program. And before I explain you more about the program and what we plan for students, what I would like to say is I would like to invite your very own alumni, Prasanna, to come and share her experience as a holistic coach. I know Prasanna, she is from Ibrahimpatnam, Vijayawada, and now she is staying in Delhi, Gurgaon, and she is working. I mean, she is one of the very first students of holistic training program, and she has been treating so many people, I mean, including doctors, and most of my family members are also her clients. So let's hear from the experience of Prasanna, and then we'll move on to our plan. Prasanna, you there?
Yes, sir.
Yeah, please.
Thank you so much, everyone, for joining this wonderful session today. And after 20 years, I got an opportunity to meet my respected ma'am, Varalakshmi ma'am, and all other Sabita ma'am. I still remember those days because we should give a gratitude once you leave the college, once we met the first time. So that's why I would like to say a good gratitude towards my college, Siddhartha Mahila Palasala. 2002 to 2005 is my I studied over there, and this is a basic mother to me for clinical nutrition and dietetics. Today I'm here. Hello. Yeah. Today I'm here because of all of my mentors. So I'm so thankful to all of ma'am, Sarita ma'am, and especially Varalakshmi ma'am, who guided us well, and a heartful gratitude first of all. I'm also thankful to Dr. Suresh Kumar sir to give an opportunity to talk about my college as well. Today I'm here as a holistic nutrition coach and giving so much of hope to the people who are suffering with diabetes, especially. For the last 2 years, I'm practicing a holistic nutrition as I am also practiced last 14 years. So I never felt this much of happiness by practicing this clinical application or MNT, that is medical nutrition therapy. So this is a wonderful opportunity, all of you guys, to enroll as a student, and you will get many more things which we are not able to study over there in our curriculums. So I request all of students to enroll this very good opportunity, and just like me. So I want everyone to be successful in their career, and don't lose your heartful things. I mean, heartfulness regarding this clinical nutrition. You will get a very good opportunities in future, because this is the right time for every nutritionist to come up like a general physician. You are not more than, of course, you are not lower than the GP. So that is what I feel. So I requested everyone, and ma'am also, please encourage all the students to come up and please join a holistic nutrition, and you will get many more things. Thank you so much for this opportunity.
Definitely, I will encourage students.
Thank you so much, ma'am.
Yeah, thank you, Prasanna. Thank you, Varalakshmi ma'am. And we have few more coaches who would like to share their experience. So especially Priya, she is from Ambala, North India, Haryana. And she is always of the opinion that, okay, if this program were there in our college days, right? It would have been a totally a different experience for us. So now she is, along with Sandhya, working closely with all the colleges, getting students from all over the country and to enroll for this program, because her aim, I mean, just like rest of the coaches aim, is that just like how there is a campus recruitment for software engineers, okay? So the dietitians, the moment they come out of the college, they should be in a position to make decent package. So they should be starting their own clinic even when they are in the college. So that is the purpose with which these people are working, both Sandhya and Priya. And I request Priya to come and share your experience and I mean, like, encourage students about the program. Please, Priya.
Thank you, sir. Thank you so much for the opportunity to, sir. And thank you, Varalakshmi ma'am, for arranging this thing for us. Prasanna ma'am is really a senior coach for all of us. And on day-to-day basis, I, as a student, try to learn from sir and Prasanna ma'am and Sandhya ma'am and Dhanalakshmi ma'am. And I really wish that when I was in my post-graduation or in my graduation, I would have got this course. I would have done really better in my career, because in my graduation days also, I was working something to do along with my studies. I never wanted to waste my time like that, okay, gossiping, chit-chatting and all those things. I wanted to utilize my time as much as possible. And but because, you know, we didn't had enough of opportunities, and some of opportunities were coming, but my parents were not allowing, because I was in out of town, and they don't want to you know, just as a kid, they don't want me to just go and work, because they were not confident what is the environment and how it is going to be. But if I would have got this as an online thing, it would have been a great experience. And second thing is, I actually got passed out 2 years from my master's. And you know what? I worked in one of the fitness companies for almost 16,000 rupees, spending 6 to 7 hours. And I was like, I was like always frustrated. Okay, this is not my worth. Okay, I deserve six-figure income. I'm doing so much for the people. I'm giving my time and energy. And I got this course. And once I got this course, within 2 months, I left my job. And in my resignation, I clearly mentioned I'm resigning because my daily worth per hour worth is 21 rupees working with you as 17,000, and I deserve more than that. And that's how and now with this course, I'm able to earn even 3 times of what I was about to get. I was charging 3,500 something for 3 months as a consultant. But now I'm charging 10,000 rupees as a consultant. Means drastic change. And lot of learning is there, lot of I cannot even express in the words the kind of support and the kind of confidence I've got in myself, just because of this community and all the senior people and sir. So this is all I want to say. And I think every student in India should be here to learn, and they should get at least 40,000-50,000 rupees as soon as they just get a pass out from their college. This is actually our worth. This is actually what we deserve. And I'm sure you all will be going to get it. And we all are with you. So thank you so much, sir, for giving the opportunity, and all the best to all of you.
Thank you. Thank you so much, Priya. Okay. So let me share with you what you are going to learn before we get to listen from two more coaches. What will you learn? You can start working with senior coaches like Priya or Prasanna. Okay. If you go to a hospital, even to do your internship and rest of the things, so you will never get an opportunity to interact with senior dietitians on the cases. Okay. So live case studies is something that you don't get an opportunity, but here you can work with senior dietitians and access to live case studies. Okay. People who are actually paying money, and you can start doing an online internship. And some of the coaches, to your surprise, they give you paid internship. That means you don't have to pay anything to them, but they are willing to give you, right? They are willing to pay you for the kind of work or the support that you are going to give the senior coaches. And never before this has happened, right? This is what the this particular holistic training program is promising you, right? First thing, you get to know how to create a case sheet and work, how to talk to a client and what their problems are and how to take the case history, prepare a case sheet and all this, and how to talk and counsel patients and how to address their concerns. All these things, live things, you can start learning from these coaches. Now let's listen from none other than Sandhya, who is instrumental along with Prasanna in making this program happen. So just listen from Sandhya's experience, what this program is all about. Yes, Sandhya.
Thank you, sir. Thank you. And thank you, students. Thank you all for joining. So I am Sandhya. I'm a clinical dietitian turned into a full-time holistic coach, full-time holistic nutrition coach. So I've been traveling with sir from past 1.5 years. And ever since I joined, I completely changed my approach towards clients. So earlier I used to focus on do's and don'ts on any particular disease. So my focus was on giving them diet plans. All the focus was on intervening in dietary concept only. Ever since I joined this course, I learned so many things that apart from diet, there are so many other things that we need to address while handling any client. So only planning diet will not help in healing patients. So we need to take other aspects also into the picture while handling any clients. And what are those other aspects, as sir just showed you on the slides? All those detailed learning, all those detailed explanation you will get to learn in this course. So apart from dietary knowledge, one should have this holistic knowledge to become a great dietitian from a good dietitian. Okay, so if you're all are aspiring to become a dietitians or working handling clients, yes, this course is absolutely perfect, and this course is mandatory because what I feel is when you have the knowledge of diet, you will only see this dietary concepts and you will restrict yourself to some extent. But when you have this holistic knowledge, you will not only transform clients, you will transform yourself, guys. When the transformation happens within you, the kind of confidence you get in treating patients is immense. When you transform your own loopholes, that same energy is transformed to your clients. So it is, dual effect. You will get transformed, and at the same time, with the same energy, with the same frequency, and the same confidence, you will transform all your clients. And once when you transform all your clients, they are your leads. So one should have this holistic knowledge to treat patients, to treat yourself, and to treat all across the people, because a dietitian is not the person who should just focus on diet. A dietitian should be a natural doctor, or if you believe that food is a natural medicine, I think doctors are the dietitians. I mean, the dietitians are the natural doctors. So if you believe that, take up this course and you will definitely transform yourself and your clients. So that's it from my end. I don't want to talk much now, only because there are so much of things that are waiting for you once you get into this ocean. Thank you, sir. Thank you for this opportunity.
Thank you, Sandhya. And before we wind up, I would like to invite one more coach, the last but not the least, Danya Lakshmi. As I said, she's from Bangalore. So I would like to, I would like all of you to hear from her experience, what is this course is all about. And she is actively working with students from Tamil Nadu as well, getting more students into this program. So Danya, if you are there, please.
Yes, sir. Thank you so much, sir. Good morning, all. So happy to address you all, because as I visited last month to a couple of colleges, I heard from the lecturers saying that when we ask them to create a diet chart, they just jump into the vegetables and fruits, which is really like exotic, like the broccoli, dragon fruit, and all those things, which is not our staple food at all. So here, coming to the practice of a holistic nutrition coach, We teach you even how to plan a food for a person who is really struggling to earn. Okay, even the cheap way of planning a diet chart. So here you get an experience as an intern to work with even a lot of low socioeconomic communities, and we work with a lot of NGOs also. So you will be a part of learning even the treating the higher socioeconomic till the lower socioeconomic. So it is just, as sir said, it is just touching the heart of each and every person. So here I would like to tell you something. All the doctors who are treating the patients just tell them as a family doctor kind of. Okay, on a longer run, they just go for the follow-up. They once the medicine is working or not working, they just go to the doctor, tell them again. But as a dietitian, you give the diet chart. If the diet is not working, they just go out and tell, this dietitian's diet chart is not working for me. That is all. Your name is gone there. And if at all you are making a kind of program where you're coaching your patients, and you are making a very good rapport and bonding with them to make them follow their regular schedules in a very disciplined manner. That is what is really a diet plan is. It is not like something exotic that we are going to give them. So when we are doing that, they are going to follow you all through the life. They are going to make you as a family dietitian. You will not believe that things are happening for us. There are a lot of patients who are calling us. You have to be there as a lifetime coach and guide us. So this is going to be a really satisfaction thing that is going to happen to us. This satisfaction gives us happiness. So that is going to be the purpose of life. So when I asked a couple of students, what is the purpose of life? They said, I want to be happy. What makes you happy? No answer for that. They don't have answer for that. So if you want to be happy, think what makes you happy first. Then get into it. Then you succeed. Thank you, sir.
Yeah. Thank you, Danya. Thank you so much. So students, are you excited about the course?
Yes, sir.
Thank you. And not only the paid internship part. Okay. So, we did a program for St. Anne's in Vizag, and there the principal and the HOD, they are happy to share with me that one of the student actually listened to this program, and she actually went through all the classes, and she started applying these principles still in her graduation. She is not even a postgraduate. She is still in graduation, and she started applying, and people started paying her. Okay. So, see, this is India, where even a 10th class fail can be a rural medical practitioner, an RMP doctor, and can give injections and can treat patients. But all of you are graduate students and science students who are learning the principles of nutrition. Okay. You can start while still you are learning and practice being a coach in your college days as well. And as I said, this community, because I never met Dhanya and I never met Priya, but we have more than 150 people from all over the country. Not only this country, we have people from all over the world, 5 different countries. And all of them is a very strong, vibrant community. Each one is helping other one out. And you can learn from so many people and so many experiences. And we have a very strong community where we do discussions on various things. It could be case studies, or it could be a subject, or it could be a book. And there are so many things that are happening. So that community support is always there. And as I said, the most important thing, the hands-on training on history taking, which you will never get. So if you ask either Dhanya or Prasanna, Priya over here, or Sandhya, they never got a chance while they are doing internship how to take a case history, how to prepare a case sheet, and how to present it, and the clinical nutrition aspect of it, how to connect the dots. They are all self-learners, but it took a lot of time for them to establish themselves as like clinical dietitians, right? But here is an opportunity, because thanks to pandemic, I would say, but everything is online. You don't have to travel anywhere. If you have a mobile phone in your hand, that is your clinic, and that is your encyclopedia. So whether you watch YouTube, Jabardast, or Big Boss, or want to learn, it is totally up to you. Okay. So if you can invest your time rightly on this particular course, right? So not only you'll be strong in your confidence and ability to handle cases, but you become a better person. Just like Sandhya said, it is not only making changes to people's lives, it transforms you as a person, right? That's it from my end. And I would like to know how many of you are interested in taking up this holistic nutrition training program. Just raise up hands, please. Anyone interested? Good. But what if I say the program costs about 24,000? How many of you are still interested? I want to see the drop in hands now. Got it. Okay, not 24,000. I'll give it to you only for 16,000. How many of you are interested? Okay, still hands are there. I would like to see more hands. What if it is only 10,000? How many of you are interested in taking up the course? Okay, hands are raising again. Good. Still, okay, it dropped. Okay, okay. And what if I say you don't even have to pay 10,000, you'll get the program only for 5,000? How many of you are interested in taking up the course? Okay, 6. How many? Rest of you, only 15 people are interested. Okay, not even 5,000. What about 3,000? If I say it is only 3,000, still only 15 people. Rest of the people are not interested in learning. Right. Okay, let me cut the suspense off. What we have come up with is, we have come up with something known as student scholarship. See, we are giving 90% off on the regular course fee. It is not 24,000 for all the students. If it is coming from your college, from your HOD, that so and so is the student. So all you need to pay is 2,500. Rest of the coaches, those who are practicing, they pay 24,000 to get into the course. But as students, all you need to do is by paying 2,500 through your college, and you can access this particular course, and you can learn all the principles of holistic nutrition. So that's it, guys, from my side. And those who are interested, I'm just typing the number. Okay, if you are interested in becoming the next GP or general practitioner, okay, so this is your chance. And I thank Varalakshmi ma'am for giving us this opportunity to interact with all of you and to share whatever we are. And I'm just typing this number on the screen, and I'll also give you the number in the chat box, those who are there. And you can save this number and get in touch with either with your HOD, Varalakshmi ma'am, or with the resource person, Sandhya, over here. Okay, thank you all very much. And I know we started at 11:10 and we completed at 12:10. So if you have any questions, I'll be happy to answer. Yeah. Thank you. Thank you very much for your time.
So students, any doubts you have? Yeah. So thank you, sir. That was a wonderful walk you just made to, for all the clarity and the detailed explanation of all these concepts. I would like to thank the main person, Varalakshmi ma'am, who just was very approachable at the first instance itself. So thank you, Varalakshmi ma'am, for giving us this opportunity to approach and give this information to reach out to all the students. And secondly, I would like to thank Prasanna to give me this contact of Varalakshmi ma'am, and of course, Suresh sir, who is our mentor, who's been the backbone for these concepts. Thank you, everyone, for joining.
Yeah, Sandhya. Hello, Sandhya?
Yes, sir. Yes, sir.
Okay, we have another student from the same college, Jahnavi. She would like to share a few things about the course. Okay, Jahnavi, are you there?
Yes, sir.
Yeah, but you need to come on camera. Good. Go ahead.
I am Jahnavi. I completed my graduation during 2005 to 2008, and I'm thankful to Suresh sir giving me this opportunity, and to Varalakshmi ma'am, Department of Nutrition. We used to have a great time there during graduation. It feels like being at home by being in the nutrition lab. Many of the nutrition students might have known this, and I'd like to recommend all the students to bravely go with this course, and it is like a beautiful opportunity that you have got during your graduation. This is the best thing that has happened.
Jahnavi, sorry to interfere. Just take off your headphones and talk, or if you're plugged in your charger, unplug your charger and talk, because there is a lot of disturbance in the mic. Thank you.
Is it okay now?
Yes, very much clear. Thank you.
Yeah, thank you. I can say this is the best thing that has happened to me during the pandemic. During pandemic, I have come across this course in FB, and I've joined this. It has been a year, and this course has transformed a lot. It made the transformation to me a lot, and the lessons that I have learned, lessons for life. This brought transformation in me first, and then we can apply this to our clients as well. And this course includes a lot of coaches who will help, like they'll be like your extended family. And, by making simple lifestyle changes and changes in your routine, you can transform yourself first, and the same can be applied to your clients as well. I strongly recommend all the students to go ahead with this course, and don't hesitate to join this course, as it is the best opportunity, and in future you can strongly feel that you have made a right step during your graduation. And this is a future scope, and how to treat a person is can be learned in this course rather than treating a disease, because the root cause has to be identified for the illness rather than the disease to be cured. Once the root cause has been cleared off, you can be fit and fine and healthy. And so I strongly recommend holistic nutrition. And our coach Suresh sir is fantastic, I can say. He explains everything, and you cannot get this opportunity, or you cannot get such kind of learnings from any Google or something, or any other source you might be looking for. My special thanks to Varalakshmi ma'am, and I'm happy to be a part of this live today. And thank you so much for this opportunity.
Thank you, Jahnavi. That's wonderful. Thank you so much. And Varalakshmi ma'am, before we conclude,
Yes, sir.
we'd like
Yes,
to
sir.
few things from you, please.
Yes, sir. Yes, sir. Sir, thank you very much. Founder Dr. Holistic Nutrition, Dr. Suresh Kumar Garu, organizing such valuable webinar for our students. Already our old students are your family members. I think there are increasing more new joinings in our family. I encourage my students to join in your organization, and give that much of scholarship to, I request you, sir, give scholarship to staff members also. We also like to join. And you enlighten very interestingly different ways, sir. And I extend my thanks to our old students, Prasanna, Jahnavi, and other organizers, Sanya, other coaches, and Priya madam. Thank you, sir. Definitely, I will encourage our students to join you in your group, sir. Thank you very much, sir.
Thank you so much.
We'll take a selfie with the students if they're on, keeping their
sure.
camera on.
Sure.
Okay.
Definitely.
Excuse me, ma'am, one last request. Can I see you? After a long time.
Jahnavi, I remember you.
So requesting students to please on your camera for 1 or 2 seconds. We'll take a snap and we'll leave. Whoever is interested to come on picture, please on your camera. It will be good memory, guys. Students, please on your camera.
Okay, this being Sunday and most of the people.
Yes, sir. Yes, sir.
Best attires.
Yeah, so I'll be taking this one. Yeah, I'll send you the snap. Thank you so much, everyone, and thank you, Sandhya, Jahnavi, Prasanna, Priya, and Danya, and especially
So
Varalakshmi
one
ma'am.
student has on her camera. Thank you.
One student, again Priya. Thank you, Priya.
Another one.
Oh. 207501. What is this? Your roll numbers or what?
Yes.
Okay. All right. Yeah, we got the snap. Thank you. Thank you. Happy Children's Day. Celebrate your Children's Day and okay. And World Diabetes Day. As I said, you are going to be the future of healthcare, right? We are 100 strong. Pretty soon, we are going to be 1,000 strong and 10,000 strong very soon. And the first point of contact for any chronic lifestyle disease, people should come to dietitians. And that's what the vision and mission of this thing. And Varalakshmi ma'am, we have a website called Holistic Nutrition Works, which is completely run by the coaches themselves.
Oh.
Okay. All of them, they have come together and collectively they are offering the service. And we have different programs. We have stop diabetes, PCOS reversal, weight loss, like that. And we wanted to extend into different programs as well. So they will be listed over there and they can practice, and there is a collaborative practice. So if someone is interested in cancer or PCOS, and they can refer them to the person who is interested in it. So we are creating a specialization in this as well.
Okay, sir. We will visit your website.
Yeah, sure, man.
Thank you. Okay.
Yeah, actually, I have my APRJC coaching and MSET coaching from Vijayawada. APRJC from Krishnaveni, Circle, and Chaitanya from Porangi campus.
Okay.
MSET. Okay, that was long back now, 1996. Okay, thank you, everyone.
Thank
have
you.
a good day.